Good afternoon, everyone. Thank you for joining us on our new hour-long Krem 2 News First at 4. I'm Tom Sherry.
It's so good to have you here. I'm Whitney Ward. We do begin tonight, though, with some grim news for our area. Idaho has now started transitioning into crisis standards of care. As a result, all elective surgeries are now being postponed. This comes as doctors say resources are being stretched to their limits. Kootenai Health's chief of staff says the hospital is now caring for the largest number of COVID-19 patients it's handled since this pandemic began. Tonight, our Mark Hanrahan is live in Kootenai County with in-depth coverage. And Mark, what do you know about help that is now coming to North Idaho?
Yeah, good evening, Tom and Whitney. What we know is that 20-member team from the Defense Department is here at Kootenai Health right now, helping the doctors and nurses in the ICU as they continue to deal with that flood of COVID patients here. The state requested the team. They'll be on site for at least 5 weeks, we're told, and they arrived here just a few days ago. So of the personnel being provided, there are 14 nurses, 4 doctors, and 2 respiratory therapists. They're at Kootenai Health to support the staff amid, as you guys mentioned, that crisis standards of care.
We were delighted to see that the standard of care was exceptional for the patients admitted at this hospital. Despite the sort of unprecedentedly large volumes of patients currently being cared for, the staff, the nurses, the physicians have been able to rise to the challenge and fight the good fight. We're also incredibly fortunate to be able to be here and provide some much needed offloading of that stress on this local system.
In the past year and a half, Kootenai Health has not once shut down their COVID-19 unit. According to Kootenai Health Chief of Staff Dr. Robert Scoggins, the hospital never got to a place where they were able to discharge the last COVID patients. Kootenai Health has maintained between 3 to 5 ICU COVID patients, and today there are around 40 patients in the ICU. This is in addition to non-COVID patients who also need to be treated in the ICU. So having the members from the DoD here is helping to relieve some stress for doctors and nurses.
It's been incredible from our standpoint because of how fast they've been able to integrate into our hospital and get up and running.
Meantime, leaders at Kootenai Health are concerned about what is going to unfold in the next coming days and weeks ahead. As we mentioned yesterday, school just resumed here in Coeur d'Alene. There is no mask mandate for students in the classroom here, no vaccine requirement for teachers either. Doctors here, I can tell you, they're concerned about that, and that may lead to even more patients. That's a big concern tonight. My colleague Amanda Rowley joining me here right now. The hospital, Kootenai Health specifically, held an update on their overflow space they have for COVID patients. It's in this building behind us here, the Health Resources Center. So what is the latest with the Health Resources Center? Are they concerned they may see too many patients for that too?
Well, it's kind of a hurry up and wait situation. Today they say there are 22 total beds in the center available for COVID patients. As of today, there are 11 people using those beds. Now, the Kootenai Health says, as we mentioned, they have 115 total COVID patients. At the beginning of August, that number was 68. Now, they say their biggest limitation right now is the number of staff to cover the surge in COVID patients and maintain care for non-COVID patients. Now, the potential need, though, for a field hospital depends on if the overflow beds reach max capacity. The hospital's chief regional operations officer says if it comes to that, they will rely on additional community support.
When those beds fill up, hopefully they won't, right? But if they do, we will continue to work within the community with the Kootenai County Operations of Emergency Management, other local hospitals, home health, skilled nursing facilities to do our best to discharge and manage patient care as best we can. If there is a need for continued field hospital resources, that becomes a tougher challenge because, again, we don't have the staff and the beds to do so. So it will be a community effort if we need to go beyond the Health Resource Center.
Now, Jeremy Evans says the hospital has 550 open positions at Kootenai Health right now. So 240 of those positions are clinical caregivers that they desperately need help with the surge of COVID patients. Now, as for COVID testing, we also asked about where they're at with COVID testing here on campus, that the drive-through option for testing at Kootenai Health is still available. I'm told even though they are seeing a high volume of tests, they are still able to get those results back as little as 48 to 24 hours.
Just driving up here today, Amanda, I saw the drive-through testing kind of behind where we're at right now. A lot of folks in that line, even at this hour. My goodness, all right, Amanda, thank you. Look, we understand this is a lot of information we just threw at you in a short amount of time. So for the very latest on the crisis standards of care activation here at Kootenai Health and everything else COVID related here in North Idaho, just text us the word COVID to 509-448-2000 and we'll send that information directly to your phone. She's Amanda Rowley. I'm Mark Hanrahan. That's the latest from Kootenai Health tonight. Now back to you.
Thanks, you guys. Well, with Idaho being forced to activate crisis standards of care, it poses a lot of questions. In Washington, hospitals are filling up too.
Yeah, so the question is, could patients from Idaho come to Washington for care even as hospitals here are also near capacity? And the short answer is yes. However, we've learned our state is under no obligation to actually take them.
We have some special processes through the Washington Medical Coordination Center, and those only apply to patients that are in a Washington state hospital. That we are not sort of guaranteeing the help to anyone that's outside of Washington state.
Healthcare leaders are warning Washington is nearing a critical point. Another big question, is it a possibility Washington could join Idaho and also activate crisis standards of care? Healthcare leaders say they are doing everything to avoid that. But if it gets to that point, the state is ready. But they add, we all need to do our part.
I don't know the words to be able to use to plead with people to please do the things that you can to prevent this from occurring, which is getting vaccinated and wearing masks and really simple things.
Today, I also had a chance to talk with the Spokane Regional Health Officer, Dr. Frank Velasquez, and he told me that local testing has also been a challenge here in the Spokane area. Increased demand means that some people are having some difficulty finding a place to even get a COVID test. He said the problem is expected to just keep getting worse as this spike in cases continues, but he also told me Spokane area hospitals are working extremely hard to try and stay ahead of the curve so we don't have to go into crisis mode here.
What kind of conversations has the health district been having with the local hospitals to prepare for even more strain on the system? Because it sounds like you do fully expect that. Is there a plan for the possibility of crisis standards of care here in Spokane like we're seeing in North Idaho now?
They are managing by, flexing staff and et cetera, et cetera. We are not talking about crisis standards of care in this region at this point in time. But I do have to tell you that's one of the areas that we've always examined. We examine all options, but right now our healthcare partners are managing. North Idaho Kootenai Health is a very specific situation. And if you think about it, one of the advantages that we have in Spokane, which is, so we are a regional referral center, and that gives us the ability to have a capacity that exceeds what you will need for a community this size.
The Department of Health across Washington also issued a statement today saying it is now working with state, federal, and private partners to mitigate this latest surge by accessing volunteer and contracted resources, information sharing, and even shifting patients to different healthcare facilities that can best support their care. They went on to say the goal is to prevent ever having to utilize crisis standards of care anywhere in Washington. We, of course, will continue our coverage here across both state lines throughout the rest of this newscast. But we do want to take a quick break and talk about the weather. Turned out to be a really beautiful day. I kind of had to do a double take when I looked at the high temperature that was expected today.
Yeah, temperatures in the 80s. Unfortunately, it looks a little better out there right now, but we had quite a bit of smoke and haze that moved into the area, and we saw our air quality rise up to moderate. There you can see it right there at 65. We are at 85 degrees right now, again, with moderate air quality. We are looking for temperatures to drop down to 55 overnight. We'll look for another high of 85 tomorrow. Some areas will get smoky or hazy, but again, mostly sunny skies expected for the weekend. Comfortable temperatures, seasonal high temperatures. Normal highs this time of year in the upper 70s. We've got 77 on Saturday, 78 on Sunday. I'll fill in the blanks with your 7-day outlook coming up in a few minutes.
Looking forward to that, Tom. Thank you very much. And still to come in tonight's hour-long broadcast, we are reflecting with an old friend of the much-loved artist Bob Ross.
Bob was such a remarkable guy. He was for real.
We'll have more on Bob's time here in Spokane and his friendship with another Spokane artist.